this half hour, we want to talk about a side effect of this storm that many Western New Yorkers are dealing with. It's cabin fever and mental health issues. That's, of course, compounded by the storm keeping people at home during the Christmas weekend. It's already a tough time of year for many people, but there are some things you can do to help deal with it. So to talk about it and give you some advice, we are joined now by Dr. Wendy Weinstein. She's the Adult Unit Chief at BryLin Behavioral Health and the president of the medical staff at BryLin. Dr. Weinstein, thank you once again for joining us here on Channel 2 at 5:30. Let's start with some perspective, however. We know that a lot of people are having a tough time being stuck at home. But what can people do to kind of combat that cabin fever and frustrations and help increase their patience?
Cabin fever, you hit the nail on the head. Cabin fever has to do with the anxiety that we're feeling because we can't control what we really can't control anyway. And so we want an end to this. We want a definite answer. We don't want this to keep going. And so we get stuck in our head and we just circle around and around and around. The best thing to do, I always tell people, is to get out of your head. And that's why we talk about helping someone else. If you are alone, if you have a neighbor that you can knock on their door and just say, "How are you?" or give them a phone call. If you're alone and you can think of something that you've been putting off, some kind of project that you can start to just get your mind out of this anxiety, which is really the cabin fever.
You're right. Part of the feeling of being trapped is that we're being repeatedly told, stay off the road so that the emergency crews and plows can do their jobs. And that can certainly cause some emotions, but it's important that people don't give in to those emotions and even talk to others in the same situation.
You hit the nail on the head. And I always tell people feelings aren't facts. Just because you feel something doesn't mean you need to act on it. So I'm anxious and I want to get out and go to the store. I'm not going to go in my car and do it. I'm going to sit back and say, right now I'm anxious. I'm going to talk to someone else because I just had this conversation with someone else today who said, everyone's anxious. And we come together as a team and say, we're not going to act on these feelings to put ourselves and other people in jeopardy. The feelings pass. This will pass. We've gone through a lot. This is going to make us stronger. We're a tough town.
You're right about that. As a community, we have definitely gone through a lot. There is a sense of community, speaking of community, in such a widespread storm like this, and that is just temporary. Talk a little bit about the sense of community as well as what resources are available for people who really do need to speak with a professional.
Well, one of the things you need to realize is, myself included, I've had to shut down my office because I work in the city of Buffalo. But I have, and most practitioners have, an answering service where we can talk to our patients 24/7. So that's available. Maybe some pharmacies are starting to open up again as well. There's always crisis services. There's suicide hotlines. There's 911. There's so much available that people can just reach out. Sometimes people think to themselves, I don't want to be a bother. Mental health isn't such a big deal, but it is. It is. Just because we can't see it doesn't mean it doesn't exist. And you're not a bother by saying, I need some help, because you'll be helping someone else who probably needs help too.
Dr. Wendy Weinstein, excellent advice. Self-care, so important, and taking care of our mental health as well. Thank you so much for joining us.